Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to elevate patient care. This is episode 10, the final episode of our case management podcast series, and today, we are looking ahead. Healthcare is evolving, and the future of nursing is not just about treating illness, it is about coordinating care, empowering patients, and ensuring that every healthcare team member works together for better outcomes. At the center of it all? Case management. Case management is more than just a process, it is the common thread that ties together patients, nurses, and the entire healthcare system. It ensures continuity, improves efficiency, and elevates the role of nursing beyond the bedside. In today's episode, our hosts, James Carter, BSN, RN, an ICU nurse, and Emily Ramirez, MSN, RN, a nurse manager, will explore how case management creates a unified approach to patient care. Why every healthcare team member plays a critical role in case management success. How patient empowerment leads to better outcomes and greater nursing impact. Why embracing case management elevates the nursing profession and prepares us for the future. They will also share insights from Dr. Nicholas Abella's article, which highlights how nurses can lead the future of healthcare through case management. And as always, we will leave you with an actionable takeaway: educate your healthcare team about the value of case management and ensure each member understands their role in providing coordinated care. The future of nursing is here. Are you ready to embrace it? Let's dive in.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're all about giving you those insights and real-world solutions to help you thrive as nurses.
Yeah, absolutely.
And today we are diving deep into a topic that is so relevant for creating a more efficient and patient-centered healthcare system.
Yeah.
We're talking about the power of case management.
That's right. And you know what's fascinating about case management?
Yeah.
Is that it's not just another task on your already overflowing plate.
Right.
It's really a strategic shift
Okay.
in how we think about and approach patient care.
I love that, a strategic shift.
Yeah.
So help our listeners understand, what's the problem that case management is trying to solve?
Well, think about it. Healthcare can often feel fragmented. You know, different specialists manage separate aspects of a patient's care.
Right.
But sometimes without a truly unified plan,
Yeah.
it's like having different puzzle pieces that don't quite fit together.
Oh, I see what you mean. And that can lead to confusion, right? Like patients receiving conflicting advice or experiencing gaps in their care.
Exactly. And that fragmentation can have some serious consequences.
Yeah.
Research from Baker and Jones in 2022
Okay.
found that fragmented care is strongly linked to poorer patient outcomes and even higher healthcare costs.
Wow.
Imagine a patient being discharged
Right.
without a clear medication plan or follow-up appointment.
Oh, no.
That's a recipe for readmission.
That's a powerful point. So how does case management step in to address this?
Think of case management as the glue that holds those puzzle pieces together.
Okay.
It's about creating a cohesive and coordinated approach where everyone involved in a patient's care is working together seamlessly toward the same goal.
So it's like having a dedicated conductor for that patient's healthcare orchestra,
Yeah.
making sure everyone is playing in sync.
That's a great analogy.
Yeah.
And the research really backs this up.
Okay.
Rodriguez and Nguyen in 2021
All right.
found that implementing case management strategies led to significant improvements in patient satisfaction, reduced hospital readmissions,
Okay.
and even increased job satisfaction among nurses.
Hold on. Increased nurse satisfaction, too.
Yes.
I bet our listeners want to hear more about that.
Absolutely.
Yeah.
When nurses feel like they're part of a coordinated team
Right.
and that their expertise is valued, it makes a huge difference.
Sure.
And that's exactly what case management fosters.
Okay.
A collaborative environment where nurses are empowered to advocate for their patients and play a key role in shaping their care plans.
I can already hear our listeners thinking, okay, this sounds amazing, but how does it actually work in practice?
Well, let's look at a compelling example from Johnson and Lee's 2021 research.
Okay.
They studied a healthcare team where nurse case managers took the lead,
Right.
working closely with bedside nurses, physicians, and other specialists to ensure every aspect of the patient's journey was addressed.
So it's not just about having a case manager title.
Right.
It's about adopting a case management mindset.
Precisely in this example, Bedside nurses were actively involved in patient education, discharge planning, and even follow-up care after the patient went home.
Wow.
They were empowered to use their expertise and contribute to the overall care plan.
That's so important, breaking down those silos and recognizing that every nurse has a vital role to play.
Absolutely.
But I'm curious, how do they keep track of everything and make sure no patients slip through the cracks?
That's where data comes in.
Okay.
This team used data insights to guide their decisions, ensuring that no detail was overlooked and that care was truly personalized to each patient's needs.
So it's like having a personalized roadmap for each patient's care, informed by data and guided by a collaborative team.
Exactly. And what's really exciting is that this kind of approach isn't limited to large hospitals with dedicated case management teams.
Right.
The principles of case management can be implemented at every level of healthcare, from small rural clinics to bustling urban hospitals.
So even if you don't have a case manager title, you can still be a case management champion.
Absolutely. It's about fostering a culture of collaboration, empowering patients to be active participants in their care, and utilizing data to make informed decisions no matter where you practice.
Okay, I'm starting to see how this can truly transform healthcare. But let's be realistic. I know some nurses might be thinking, this all sounds great, but where do I even begin? And how do I find the time with everything else on my plate?
Those are valid concerns, and we'll definitely address them in the next part of our deep dive.
Okay.
We'll be sharing practical strategies and real-world examples of how nurses are successfully implementing case management principles, even in the busiest of settings.
I can't wait to hear more about that.
Me too. But before we move on, I want to emphasize that even small changes can have a ripple effect.
Okay.
As Turner and Williams highlighted in their 2020 research, even simple things like a well-coordinated discharge plan or a proactive follow-up call can significantly impact patient outcomes.
I love that.
Yeah,
It's a reminder that every nurse, regardless of their role or setting, has the power to make a difference.
absolutely. You know, as we were prepping for this episode, it really struck me how much of what nurses already do naturally aligns with case management principles.
Right. We're constantly advocating for our patients, coordinating their care and thinking holistically.
Exactly. It's like case management is already woven into the fabric of nursing. It's just about bringing it to the forefront, giving it a more defined structure and framework to amplify its impact.
And that's where those resources we mentioned on healthcarenurses.net can be super helpful, right?
Absolutely.
Like those checklists and webinars that give practical tools and strategies.
Absolutely. They can really help you streamline your workflow and integrate case management more seamlessly into your daily practice.
Okay, so for our listeners who might be feeling a little overwhelmed, what would you say is a good starting point?
Well, remember, it doesn't have to be this massive overhaul. You can start small, focus on one specific area for improvement, one patient population, or even just one new strategy at a time.
I like that. So, for example, you could choose one high-risk patient and really hone in on their care plan, making sure everyone on the team is communicating effectively and on the same page.
That's a perfect example. Or maybe you focus on implementing a standardized discharge checklist to ensure patients have all the information they need before heading home.
Those small changes can make a huge difference.
Yeah,
Better outcomes for the patient and way less stress for the nurses.
exactly. And think about it, as you start to see those positive results, it creates this ripple effect. You'll likely inspire others to get on board with case management too.
And that's a key point, right? It's not about forcing a new system on people. It's about showcasing the value and getting everyone excited about what's possible when we work together.
And let's be honest, who wouldn't be excited about happier patients, more fulfilled nurses, and a healthcare system that just runs more efficiently? That's a win for everyone involved.
Totally agree.
Yeah.
But we have to acknowledge that there might be some roadblocks.
Ah.
What are some common concerns you hear from nurses about implementing case management?
One of the biggest ones is time nurses are already stretched thin, and the idea of adding one more thing can feel really daunting.
Right. It's like, where am I going to find the time for case management when I'm already juggling a million things?
Exactly. But as we mentioned earlier, the beauty of effective case management is that it actually saves time in the long run by preventing complications, reducing readmissions, and just making everything run more smoothly. You end up with more time, not less.
So it's like that old saying, an ounce of prevention is worth a pound of cure.
You gotta invest a little extra time up front, coordinating care and anticipating needs, and you'll save yourself a lot of headaches down the road. Plus, remember, it's not about doing it all yourself. Case management leverages the expertise of the entire healthcare team.
Well, that's a good point. Nurses, physicians, pharmacists, social workers, therapists, everyone has a role to play.
Absolutely. It's about breaking down those professional silos and operating as a cohesive unit with the patient at the center.
Okay, that makes sense. But what about nurses working in settings without dedicated case managers, like smaller hospitals or clinics where resources might be limited?
That's a great question, and it's important to remember that case management principles can be applied anywhere, regardless of the size or resources of your facility.
It's about shifting to that collaborative mindset and really committing to patient-centered care no matter where you practice.
Exactly. And remember, even small acts of coordination and follow-up can have a huge impact. Think back to the research from Clark and Smith in 2020. They found that a simple follow-up phone call after discharge significantly reduced readmission rates.
Wow, that's incredible, just a phone call.
Exactly. It shows that even in settings without dedicated case managers, nurses can make a huge difference by incorporating those core principles into their practice.
So it's all about being resourceful, finding creative solutions, and adapting to the unique needs of your workplace.
Absolutely. And that's where connecting with other nurses and sharing best practices can be incredibly valuable.
Which is why we really recommend checking out the Nurses Link Up app. It's a fantastic platform to network with, learn from, and get support from other nurses who are passionate about case management.
It's like having a virtual community of case management champions right at your fingertips.
Okay, so we've talked about time constraints and limited resources. What are some other roadblocks that might come up?
Another one is data. Some nurses might feel intimidated by the idea of using data in their practice. They might think, I'm not a data scientist. This isn't my area of expertise.
It can definitely feel overwhelming, especially with the amount of data available these days. Electronic health records, patient portals, wearable technology. It's a lot to process.
It is, but the key is to remember that we don't have to become data analysts overnight. The goal is to use data wisely to make it meaningful and actionable in our everyday practice. And that starts with just taking a closer look at the information we already have access to.
So are you saying we need to shift from simply collecting data to actually analyzing it, interpreting it, and using it to drive improvements in patient care?
Exactly. And those data visualization tools we mentioned earlier can be really helpful here. They can help us see patterns and trends that might not be obvious just from looking at raw data.
And they can make it much easier to communicate those findings to other members of the healthcare team, right? Like if you're tracking readmission rates for a particular patient population, you could use a data visualization tool to create a chart or graph that clearly shows the trends over time.
Exactly. That can help you pinpoint potential areas for improvement and make a much stronger case for implementing those new interventions.
So even if you're not a data whiz, you can still leverage data to improve your case management practice.
Absolutely. Start by identifying a few key metrics that are relevant to your patient population and track them consistently. You might be surprised by what you discover.
Okay, I think we've covered a lot of ground here. We've talked about the benefits of case management, some potential challenges, and the importance of utilizing data.
We have, but before we jump into practical strategies, I think it's important to take a step back and appreciate the big picture, what it really means to fully embrace case management as a philosophy of care.
You're right. It's about so much more than just checking boxes or following protocols.
It really is. It's about shifting from a reactive to a proactive approach to healthcare, seeing the patient as a whole person and empowering them to actively participate in their own care.
And recognizing the incredible power nurses have to lead this transformation in healthcare. We have the knowledge, skills, and compassion to make a real difference in our patients' lives.
Couldn't agree more. And I think that by embracing case management, we can create a healthcare system that is truly patient-centered, efficient, and compassionate, a system where patients feel heard, understood, and supported.
And a system where nurses feel valued, empowered, and truly fulfilled in their work.
Exactly. It's an ambitious goal, but I believe it's one we can achieve together.
I'm so glad you said that. And to our listeners, if you're feeling inspired and ready to take action, we've got you covered. Stay tuned for the final part of this episode, where we'll dive into specific strategies for putting case management principles into practice.
And we'll also share some inspiring stories from nurses who are already using case management to make a real difference in the lives of their patients.
Plus, we'll answer some of your questions and make sure you have all the resources you need to become a case management champion. Welcome back to the deep dive.
Ah,
We are so excited to wrap up this conversation about case management and really focus on equipping you with the tools to make it happen in your own practice.
absolutely. It's all about taking those inspiring ideas
Yeah.
and turning them into action.
I love that. So let's talk strategy.
Okay.
We've discussed collaboration data and a proactive mindset, but what are some concrete steps nurses can take right now to implement case management principles?
Well, one of the most powerful tools
Yeah.
we have as nurses is good communication. Clear, concise, and consistent communication is absolutely foundational to effective case management.
You're so right. And that means communicating not just with our patients, but with the whole healthcare team, right?
Exactly. Physicians, pharmacists, therapists, social workers, everyone needs to be on the same page, working together seamlessly.
And it's not just about giving information.
Right.
It's about truly listening to patients, understanding their needs and concerns, and incorporating their goals into the care plan.
I couldn't agree more. Speaking of patients,
Yeah.
let's not forget about the critical role of patient education. Empowered patients are more likely to be engaged in their care and have better outcomes.
That's so true. When patients understand their condition, their treatment plan, and potential complications, they can truly partner with us in their healthcare journey.
Exactly, and it's not just about handing them a pamphlet.
Right.
It's about providing clear explanations, answering their questions, and giving them the resources they need to make informed decisions.
So it's about empowering patients to advocate for themselves and really take ownership of their health.
Precisely now, on the practical side, we can also leverage technology
Okay.
to make case management more efficient. We live in a digital age,
Ah,
and there are so many tools available to help us streamline workflows and improve patient care.
right. Electronic health records, patient portals, telehealth platforms. These can all be incredible assets for communication, coordination, and data tracking.
They absolutely can. And remember those checklists we talked about earlier?
Oh, yeah.
They're a simple but powerful tool that can make a huge difference. A well-designed checklist can help ensure that important steps aren't missed, reducing errors and improving patient safety.
Oh, I love a good checklist.
Me too.
And they can also be a valuable communication tool,
Yes.
providing a clear roadmap for everyone involved in the patient's care.
Exactly. Now I know that implementing any kind of change can be challenging.
Right.
It's easy to feel overwhelmed, especially when we're already busy.
It's like, where do I find the time for all of this?
Yeah. That's why it's so important to start small. Pick one area for improvement, one patient population, or one new strategy, and focus on making a positive impact there.
So don't try to do everything at once. Just choose one thing and build from there.
Exactly. And don't forget to celebrate your successes along the way. Recognize the progress you're making, the positive impact you're having on patients' lives. That positive reinforcement can be incredibly motivating.
That's such great advice. And it's a good reminder that we're not alone in this.
Right.
There's a whole community of nurses who are passionate about case management and eager to share their experiences and support each other.
That's so true. And if you're looking for that kind of community and support, be sure to check out the Nurses Link Up app. It's a fantastic platform to connect with other nurses, find mentors, and share best practices, all right at your fingertips.
It sounds like an amazing resource. And of course, don't forget about healthcarenurses.net for tons of helpful resources on case management, including articles, checklists, webinars, and more.
Yes, we're committed to providing you with the tools and knowledge you need to be successful.
Well, we've covered a lot of ground in this deep dive into case management, from understanding the core principles to addressing common challenges and exploring practical strategies.
We have.
I hope you're feeling inspired and empowered to make a difference in your practice.
I hope so too. Remember, you have the knowledge, the skills, and the compassion to truly transform healthcare. And by embracing case management, we can create a system that's both effective and truly patient-centered.
Beautifully said so. So as we wrap up, what's one final takeaway you'd like to leave our listeners with?
If you take away just one thing from this deep dive, let it be this: never underestimate your power as a nurse. You have the ability to make a profound difference in the lives of your patients. And by incorporating case management into your practice, you can amplify that impact, creating a ripple effect of positive change that extends far beyond the individual patient.
That's such a powerful message. So to all our amazing nurses out there, keep advocating, keep innovating, and keep leading the way toward a better future for healthcare. Thank you for listening to the Healthcare Nurses Network podcast.